Healthcare today is a large industry, and frankly, we haven't changed our general model of healthcare in a number of years. And that has allowed some new competition to come in and cause us to think really differently about how we care for patients.
There's a shortage of primary care physicians, and part of that is because the burden of work that's being placed on primary care and expected from primary care, because there's not enough hours in the day to be able to deliver all of the evidence-based recommended care. Unfortunately, much of what happens, it becomes reactive. There's a prioritization that gets placed on seeing people when they're sick and responding to crises and emergencies rather than a proactive, preemptive focus on how do we solve a problem much further upstream before it develops into a downstream complication.
Ochsner is actually a not-for-profit integrated health system founded in 1942, so we've been around for over 80 years at this point. We have most of our physical locations in Louisiana and Mississippi, with some clinics in some of the outlying states. And digitally, we offer our programs in all 50 states and have patients scattered all across the country. The program was really built over 9 years ago as an internal quality initiative. Really what we built was essentially a specialist that our primary care providers can use to send their patients to better manage conditions like hypertension and diabetes, just as, or better than, frankly, we would do in a clinic or in a primary care setting. The end result was that we saw such great outcomes that from there it just started to grow.
At Ochsner, we're developing digital solutions for our own patients. And so our incentive is purely about how we drive the most efficient and effective care for our patients. We're also an academic health system, which means we have a long history of rigorous academic study. So you put those two things together, and the onus is on us to not only develop these solutions for our patients, but also to do the rigorous studies that are required to prove they're effective.
Digital medicine is basically an algorithmic approach to managing chronic conditions. So it improves outcomes because it more reliably delivers evidence-based care across a large population in a scalable manner where you can reliably drive evidence-based care over a continuum. And when you're achieving hypertension control rates of above 90% or diabetes control rates of greater than 90%, you are then reducing the risk of things like heart attack or strokes or progression of chronic kidney disease and conditions that become much more expensive to manage once they have more fully evolved and complications have ensued. These solutions are patient-centered solutions, which are not only the right solution for the patient, but they're also great solutions for the provider as well.
The real impact of digital medicine is that we have shown that we can improve the quality of care while reducing the total cost of care. For our patients, it really means that we've been able to meet them where they are and provide them high-quality care in a way that's convenient for them.
So I think the biggest differentiator is that kind of genesis of the program. The fact that this program was built originally just to drive better outcomes in a patient population. It wasn't designed to be a product. It wasn't really designed to be something that we're going out and selling or trying to drive as a profit center. And that puts a big differentiator versus typical point solutions or tech startups in healthcare. And that was really started just to kind of drive those outcomes and really grow the fact that it worked so well from there. And ultimately, we had the advantage of knowing that it worked before we started taking it out.
Part of digital medicine is really seeking to build continuous connected relationships that are built on a foundation of trust. And so what this really is compassionate, connected care delivered continuously over time through a digital solution. What I'm most excited about for these digital medicine solutions is not only the excellent results that we can achieve in the management of hypertension, diabetes, obesity, and other cardiometabolic conditions. We're going to reduce the cost of medical care, making it more affordable for everyone, while at the same time improving the lives and the outcomes of the people we are so fortunate to serve.